This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Cold and flu season in full swing. With all the recent reports on the safety of acetaminophen, you may be searching for something else to break your child's fever. The one key ingredient that you need to make sure that you avoid when it comes to your kids is aspirin.
But simply looking at the name of the little pill isn't enough. You need to look a little closer when it comes to the labels. Forms of aspirin can be found in things like face and acne creams, anti-nausea and diarrhea medications, even muscle rubs and topical creams.
So why, you may be asking, the concern? Because aspirin use has been linked to Reyes syndrome, a serious condition in children that some of the medical world fear could be making a comeback.
And here to tell us more about the condition is Peninsula Regional Medical Center pharmacist Sandra Gerges. Thanks for joining us this afternoon. Let's start off by explaining to those who may not know what Reyes syndrome is.
Well, Reyes syndrome is a very serious but very rare condition. Can be associated with the use of aspirin following usually a viral infection. It affects the liver and the brain, so you can see liver damage associated with it, and also swelling in the brain, which could lead to serious side effects such as a coma or even death. Again, it's linked to the aspirin use, and it can happen even a couple weeks after a viral infection. So cold and flu symptoms, chickenpox, those are times when you want to avoid the use of aspirin in children.
Now we keep saying kids. What age are you talking about when it comes to kids?
So we typically see it between the ages of 4 and 14 years, but it can even occur in infants and toddlers all the way up to 19 or 20 years of age.
Why?
Well, unfortunately, we don't really know why it happens. We just have seen a lot of studies that show the link between aspirin, viral infections, and the development of Reyes syndrome.
So if we're supposed to avoid giving it to our kids, then why is it called baby aspirin to begin with?
I know, I hate that they call it baby aspirin. It goes back to the doses that are available on the market of aspirin. So the standard strength of aspirin is 325 milligrams,
right,
but the lower dose, or the baby dose, I guess, is the 81 milligrams. So it's just referring to a lower dose that you can take.
Okay, so just avoiding that pill really isn't enough, because there are several different names that we need to be looking for, right?
Yeah, there are a lot of different products on the market that have aspirin or aspirin-like products within them. So you really want to read the labels, look at the active ingredients part of the label.
Okay.
You can look out for names like acetyl salicylate, acetyl salicylic acid, salicylate, salicylic acid, bismuth subsalicylate. These are names, that salicylate part is really what you want to look for on the label. If you're ever confused or you're not really sure if it's appropriate for your child or not, they're usually located right in front of the pharmacy, so you can take them to ask the pharmacist, call your doctor, ask your doctor to make sure you're really getting an appropriate medication for your child.
And the salicylic acid, did I say it right?
Yeah.
That's in like acne creams and things like that. I didn't know that was aspirin.
Yeah, so it's in a lot of the acne creams, the face washes, and we're not sure how much really gets absorbed when you're using these face washes, so it'd be good to avoid in children and young teenagers.
Right.
Okay, so Reyes syndrome, what are we looking for as far as symptoms, signs and symptoms?
So the symptoms you want to look out for, starts out with nausea and vomiting. It can last for several hours, the vomiting associated with it. It can cause lethargy or really make the child really sleepy. In infants, you might see diarrhea or rapid breathing associated with it. And again, you might see changes in behavior, so irritability, aggressive behavior. Those are things you want to look out for in children.
If I suspect my child has Reyes syndrome, what should I do?
Well, early detection is key in this case. So if you're starting to see some of these symptoms, they've recently taken aspirin, you want to contact your doctor right away. May need to take them to the emergency room. And there's no real cure necessarily for Reyes syndrome, but with supportive care, it can resolve on its own.
Okay, so we're talking about all these bad things with aspirin, but aspirin is not a bad medication.
Right, it does have a lot of benefits, usually for adults and elderly patients. If they've had a recent heart attack or stroke, daily aspirin can be really beneficial to these patients because it has a blood thinning effect for them.
All right. Thank you so much for helping us get out the word on this. Very important for parents. And if you would like to learn more from PRMC about Reyes syndrome, go to delmarvalife.com and click on the show tab.
Well, something you could be doing to harm yourself, mini fasting. Many people are using it as a way to drop weight quickly, but have you ever wondered what type of impact it could be having on your body? Wait till you hear what a few new studies suggest.
Plus, with so many patterns and colors and textures, many people are turning to wallpaper once again to spruce up their homes. But when it comes to this decorating technique, a lot has changed over the years. We'll take a look and find out how you can make it work in your home. Delmarva Life, we'll be right back.